Good day. My name is Imelda Williams. For this presentation, I'm going to just demonstrate how the image interpretation software works. And for this, I have a need to demonstrate. So it's very similar as the software that you use in the radiology systems. So you can zoom in and then also again use the hand to move it up and down. And then if you want to do some windowing, you can do that as well. And if you want to reset to the original, right at the end, there's a reset button that will take it back to the original settings. Now, seeing that we have a knee, one thing that's important, of course, is to make sure that the condyles line up with each other. So you can use the measuring tool to do that. You can see that they do line up. And if you want to get rid of all of the measurements, you can just go into the top one and the drop down menu, it will take it all away. There's, of course, in measuring here, you can use some of the other tools. So you can draw an angle. You can use ROI, which you will use with the CT. And then if you want to draw an arrow or some annotation, so you can hide and show graphics and annotations here. Okay, so that is when you want to look at a single view. And it's important, if you want to look at the next view, is to have the pointer on. And you can do that by just swiping through the image. And then in this image again, let's just zoom in and see if there's anything that's abnormal. And the one thing that we have here, which is a normal variant, or if this was a trauma case, this would be an incidental finding. And what we have is Osgood-Schlatter's disease, and that's where we have got osteochondritis, so avascular necrosis. If we want to, let's just get this back to normal. We have the option, of course, of viewing more than one image at a time. That's a single one. And here we can view both images. If we go to the patient history, here we can see that there's only the one case, but you will have more cases as well, and they will all appear in chronological order here. And then we just need to put the AP on. Oh, sorry, we need to get back to the original and make sure that we've got that on. There we have the AP view. So you can view both of those images together. You, of course, also have the option of choosing 4, and that is the basic layout that you can have. So that is the basics. If you want to view plain X-rays, the only thing when you measure, though, is because the images that I have is JPEG and a DICOM, the measurement will be in pixels and not in millimeters. So hopefully that makes sense to you all. And I will also post practice banks throughout the time. So I hope that if you have any questions, that you will contact me.